According to the Ohio Department of Rehabilitation and Corrections, the medical department at the Dayton Correctional Institution is doing fine. Their official data states the facility has a highly manageable healthcare vacancy rate of exactly 7.89%. But outside the facility, in the rain, the SEIU 1199 nurses who actually work there paint a very different picture. They are holding picket signs, citing chronic understaffing and a total collapse of morale. The union representative, Jeff Davies, has demanded a 25% pay increase. That is a desperate attempt to halt a mass exodus of medical personnel fleeing the prison. Inside the walls, the stakes are literal life and death. In recent months, 2 inmates, 36-year-old Ashley Baldwin and 21-year-old Elise Snow, died under circumstances their families attribute directly to inadequate medical care. As this diagram shows, we have an official statistic suggesting a nearly full medical staff, weighed against protesting nurses and dead inmates. The math does not add up. To understand the discrepancy, look at how the healthcare industry normally counts its workers. A standard hospital calculates its vacancy rate by comparing the total number of budgeted positions against the medical staff physically on site and available to work. But research by analyst Robert Baldwin reveals the Ohio Department of Rehabilitation and Corrections utilizes a completely different, misleading methodology. The state uses a phantom staffing loophole. Positions count as staffed as long as a name remains on the payroll spreadsheet, even if unavailable for duty. Recalculating based on actual coverage reveals a real vacancy rate of nearly 40%. This loophole creates a phantom workforce. It produces a clean, optimistic number, but provides zero actual medical care. Map this statewide data failure onto the Dayton Correctional Institution, and you see exactly how a medical team erodes. Historically, Dayton maintained a baseline of 9 to 10 full-time state nurses, occasionally bringing in a few agency temps to fill minor scheduling gaps. Today, only 4 state nurses are left on the active roster, vastly outnumbered by temporary agency placeholders. The experience drain is severe. Of those 4 remaining state nurses, only 1 has been working at the Dayton facility for more than a year. Over the last year and a half, the senior nursing staff quit. Because the state uses a payroll metric instead of a physical headcount, that mass exodus was masked, leaving a hollowed-out, inexperienced team in charge of a complex prison population. A phantom nurse cannot administer medication, treat an overdose, or respond to an emergency. Every empty shift dumps the physical workload entirely onto the remaining staff. Chronic understaffing directly causes mandatory overtime. Nurses are forced into back-to-back shifts under extreme pressure, operating in dangerous working conditions. Those brutal conditions inevitably burn out the few nurses still showing up. They quit for their own safety, which widens the staffing gap and forces even more overtime onto whoever is left. Recruiting replacements is practically impossible. We are in the middle of a national nursing shortage, and active investigations into preventable inmate deaths act as a massive deterrent to any potential applicant. By relying on flawed, phantom data, state leadership has blinded themselves to reality. They have trapped their remaining medical staff in an impossible situation and left the prison population in mortal jeopardy.